Okay, Assalamualaikum warahmatullahi wabarakatuh and good evening for my lecturer and fellow friend. Ladies and gentlemen, may I is about to begin. Before we go to our session, I will show you my video montage, my group video montage. So, please open the video montage. Welcome to the webinar session for our group, which is group 7. The big topic today is health. Following the COVID-19 epidemic that is plaguing our country and even the whole world, so we will talk in more depth more about whether it is COVID-19. Before that, let me introduce our panels today. Which is we grew two. Okay, sorry. Before that, let me introduce our panels today. Okay, so the first panel is Dr. Wahidah as a specialist doctor. So, how are you, doctor?
I'm fine, thank you.
Okay, welcome. As a frontliner, we all know that all these frontliner, especially those working in hospital, have worked hard and worked beyond their usual time. I'm amazed and touched by the sacrifices that have been made. Okay, the second panel is Puan Shazrina as a former patient. So, how are you, Shazrina?
I'm fine, thank you, moderator.
Okay, welcome, Shazrina. I believe there is a lot you want to share about your experience as a former COVID-19 patient, and the audience is also looking forward to hearing the experience you will share after this. Okay, the third panel is Mashita, as a family member of this COVID-19 patient. So, how are you, Mashi?
Yes, I am fine today, and I hope you are fine too.
Okay, thank you, Mashita. I'm fine also. I also sympathize with the death of your family member. I hope you and other family member are resilient and patient with what happened. Okay, the last panel is Puan Arifah, is as a nutritionist. How are you, Arifah? Arifah, are you there?
Good moderator. By the way, thank you for inviting me today, and I hope that I can share something with you guys today.
Okay, thank you, Arifah. I'm sure the audience will pay full attention to you later. This is because in this COVID pandemic, the audience want to take safe steps to take care of themselves, especially in terms of nutrition to avoid being infected with this COVID-19 disease. Okay, let me introduce myself. My name is Aiman Arshad. I am moderator for this webinar. Turning to our topic today, what is COVID-19? It is certain that the audience and the public out there already know what is COVID-19. But today, we want to know more clearly and accurately about COVID-19. I would like to invite Dr. Wahidah to explain in more detail what is COVID-19. Welcome, Doctor.
First of all, thank you, Aiman, as our moderator. My name is Nur Wahida, and I am a
I'm a doctor at Hospital Sungai Buloh. It's great to be speaking with all of you today. Okay, back to our discussion. What is coronavirus? A coronavirus is a kind of virus that causes an infection in your nose, sinus, or upper throat. In early 2020, after December 2019 outbreak in China, the World Health Organization identified SARS-CoV-2 as a new type coronavirus, which what we call COVID-19. COVID-19 can affect COVID-19 can affect your upper respiratory tract, which is sinus, nose, and throat, or lower respiratory tract, which is one part and lungs. So basically, it spreads mainly to person-to-person contact. So that's all my explanation about coronavirus. Thank you. Next, Aiman.
Okay, thank you, Dr. Wahida. COVID-19 is not only contagious, but it is capable of triggering respiratory tract infection. It can affect the upper respiratory tract, like sinus, nose, and throat, or the lower respiratory tract, like waist and lung. The next question I would like to ask doctor is, what they do after a person is diagnosed with COVID-19?
Okay, once people diagnosed with COVID-19, the treatment plans for them are based on 5 levels of severity or clinical category of patients. So first category, with a patient with no symptoms. Second, symptomatic without lung infection. And third, symptomatic with lung infection. Fourth, symptomatic with lung infection and need oxygen supplementation. So lastly, category 5, critical patient with multiple organs complication. So generally, there is no specific treatment for COVID-19 patient in category 1. For category 2 and 3, the patient will be given symptomatic treatments such as medicine to relieve fever, colds, and flu. Furthermore, care will be given to patients to optimize their nutritional status and maintain good blood circulation. The use of more specific types of medicines are meant for more critical ill COVID-19 patients, such as category 4 and category 5. So in Malaysia, all patients who are confirmed positive for COVID-19, including those who are with mild symptoms, will be treated at the designated treatment centers, which are either in hospital or quarantine and low-risk COVID-19 treatment center, which what we call PKRC. This means all COVID-19 patients are isolated from the community. This approach is effective in reducing the risk of COVID-19 infections from spreading to the community. At the treatment centers, the clinical progress of COVID-19 patients will be closely monitored in terms of vital signs, blood type, blood tests, and imaging according to the patient needs. This helps early detection and prompt treatment to prevent patient deterioration, especially patient from category 3, 4, and 5. So that's what we do once people diagnosed with COVID-19. Thank you. Next, Aiman.
Okay, thank you, Dr. Wahida, for your information. Okay, next, I would like to ask a question to panel 2, Puan Shazrina, as a former COVID-19 patient. Okay, Shazrina, what are the symptoms that you have?
Okay, thank you, moderator. Assalamualaikum and hi. I am Shazrina Rahman, a student and a former patient of COVID-19. First of all, I am talking about my experience with COVID-19 with my 7-day symptoms, and I'm just sharing what happened to me personally. So obviously, it is very different for everybody because everyone has a different experience with this illness. Some people have a lot severe than I had, and I will consider myself lucky to have a milder version. I also did not need to transfer to hospital and just stay at quarantine center as I did not have serious problem like breathing difficulty. So I was exposed to COVID-19 last year on November 3rd after I visiting my uncle. But I started showing symptoms 4 to 5 days after my exposure to the virus occurred. For the first half day of my symptoms started to show, I felt 100% completely fine. But then I began feeling itchy over the course of 1 to 2 hours, and I also started experiencing chills as well. But I did not have fever when I took my temperature. Right. I woke up on day 2, and still did not have fever, but the body aches and chills still continuing. I also still did not experiencing common symptoms like cough, shortness of breath, and others. On day 3, I woke up without any itches or chills, but my nose was extremely runny, and my whole face felt like it was under a ton of pressure. On day 4, my runny nose turned into a completely stuffed up nose. It was awful. The sinus pressure continued, and that was probably the most miserable day for me. Day 5 was a slight improvement from day 4. I finally could breathe through my nose slightly, but at this point, I completely lost my sense of taste and smell. To me, this was one of the worst aspects of COVID-19 symptoms. Day 6 was the first day I started to feel better and slightly more human. I become more productive even though I still experiencing symptoms like loss of taste and smell, very mild occasional cough, and slightly less runny nose. My sinus pressure also reduced. Day 7 was the last day I felt sick on the COVID-19 symptom. There are few lingering symptoms like loss of taste and smell, runny nose, but the worst part was over for me by day 7. Okay, moderator, next question.
Okay, thank you, Shazina. What have been narrated through the experience of former COVID-19 patient, we can conclude that the disease does not show several symptoms at the onset of infection. However, after a few days, patients will begin to feel change in themselves, such as loss of taste and smell, runny nose, and shortness of breath. Okay, the next question that I want to ask Shazina is, what is your advice to people out there?
All right. Firstly, my advice is please believe that this pandemic that happening now is real. I say this because as a COVID-19 survivor, I have no idea why there are so many people who still refuse to believe about this pandemic. There are so many doctors and experts who have shared information about COVID-19. So please do not easily believe the fake news or any conspiracy theories about COVID-19. Also, please do not take this virus lightly as I was infected even though my uncle did not develop any clear symptoms. Hence, always wear a mask that covers both of your mouth and nose when you are around others, especially crowded places. Other than that, don't forget to clean your hand frequently with soap and water or hand sanitizer. Next, stay at home and don't go out unless necessary because the fewer people you around, the lower your chance to get infection. Lastly, my advice is please stop being selfish and ignorant and always follow the SOP that's set by the government because this is part of the new norm in our daily life in order to fight with this COVID-19. Thank you. That's all from me.
Okay, thank you, Shazina. Okay, hopefully the audience as well as the community out there are aware of the danger of this COVID-19. I am confident and certain that society is now starting to take COVID-19 seriously after hearing the experience of former COVID-19 patient. Thank you a lot, Sarina, for sharing your experience to us. Okay, next we want to asking question to panel 3, Mashita. As a family member of this is COVID-19 patient, so what do you feel, Mashita?
Thank you, Mr. Aiman. Assalamualaikum. I am Mustaha Denan as this is family members. First of all, people who have died due to COVID-19 is my sister. She was 40 years old. One day, she had a cough and fever since early morning. So my family and I felt it was probably just a normal fever. We took her to the hospital for a swab test. After 5 days, she still had a fever and flu. And the next day, we got the result showing my sister had positive COVID-19. We shocked about that. After a few hours, an ambulance came to pick up my sister and the rest of us had to quarantine at home. Our feeling as a family at that time were very sad to see my sister go alone and leave her son with us. After a few weeks, we felt very sad when we got the news from the hospital about my sister was died. That's all, Mr. Aiman.
Okay, thank you, Mashi. Of course, this became a very sad incident in Mashi's life. Me and all the spectators also sympathize with what happened. Hopefully, Mashi and family will continue to be strong to go about daily life as usual. Okay, other question that I want to asking is can you contact your sister before she died?
Okay, thank you. Actually, my sister was in the regular ward for 2 weeks and was admitted to the intensive care unit ICU for 1 week. My sister became seriously ill and needed the help of a respirator. The doctor said this is because my sister had kidney disease for the past 5 years and is quite critical for the past 2 years. So she did not last long to fight COVID-19 virus. Since my sister go to the ambulance, that was the last time I could see her face in front of my eyes. When she was in critical condition, we asked the nurse there to make a video call. And the next day, the doctor called us to tell the news about my sister was died. At that time, my family and I were not allowed to manage my sister remains until the burial peak. Everything is managed by the hospital. My family and I can only see it from afar. That's all from me, Mr. Aiman.
Okay, thank you so much, Mashi, for your explanation. Okay. Now we know when a person is infected with COVID-19, the hospital will manage the patient 100%. Family members will indeed not be able to see the patient even if the patient has died. Okay, we go to the last panel, panel 4, which is Arifa as a nutritionist. So Arifa, the question that I want to ask you is, did you have any suggestion food to avoid COVID-19?
First of all, thank you to our moderator. And I'm so sorry because I cannot open my camera right now due to my lower internet connections. So back to our topics. Assalamualaikum warahmatullahi wabarakatuh. My name is Arifa Kila Binti Ruzi. I am a nutritionist from Nutrition Society of Malaysia. So related to our current situations where everyone are in a battle with an invisible enemies, which is coronavirus, I really hope that everyone can do all the necessary things that can keep us away from the virus. Besides, follow all the advices, all the medical and also social advices given from our government. We also have our own responsibilities to our bodies, which is we have to build up our body defense and also to strengthen our immunity system. One of the method that we can use to build up our body defense and also our immunity system is by practicing healthy eating. So without wasting any time, I will give some tips of healthy eating that we can do in our daily life. So the first one is consume more vegetables and also fruits. This is because vegetable and fruits contain a lot of phytonutrients, vitamins, and also minerals that can act as antioxidants. As we know, antioxidants can boost up our immunity system. Then when our immunity system becomes stronger, then our body can easily fight with the virus that manage to enter our bodies. The next one is consume variety of them with different colors to ensure that our body get different kinds of nutrients. I know that consuming vegetable and also fruits is not a favor for some of us. That maybe because of the tasteless or because we cannot find our favorite fruits or our favorite vegetables. But for the sake of healthiness, I really hope that everyone just don't be fast, just consuming it and don't ever take other alternatives such as supplements, especially the supplement that did not have any certificate because there is no evidence shown that the supplement can cure our immunity system. And the next one is consuming variety of foods in an appropriate amount. Consuming variety of foods such as vegetable, fruits, fish, whole grain cereal, and others can give us a better chance to receive all the nutrients that our body needed. This is also important because there are no single food that can actually fight with the virus alone. And eating in an appropriate amount or in a right portions is also important because overloading of nutrients also can harm our immunity system. And the last one is, besides controlling our eating habit, we also have to keep our body and physical active, even though we are having our activities that we can do at home to ensure that our body and physical are active. For example, we can clean our house that maybe we are not done that for years, or we can clear our garden that maybe had overgrown with the grasses, or even we can play with our children. This is because keeping our body and physical active is also an important element to boost up our immunity system. And for our conclusions, for my conclusion, sorry, I really hope that every of us can follow all the SOPs, follow all the advices given from our governments, and do all the do and practicing those tips that are given just now to at least help us a little bit to fight with the coronavirus. So a quick reminder from me, COVID-19 is real, so don't risk yourself, because when you risk yourself, you also risk your loved ones, your families, and everyone. And I also believe that we can change this situation together if we want to change it. So that's all from me. Back to our moderators. Take care and thank you so much.
Okay, thank you for Arifa. Okay, thank you for your informative and interesting talk. Now we need to know how to avoid COVID-19 from our nutrition. For the first, we need to consume more vegetable and fruit. Second, we must eat balanced meat in appropriate amount. And the last one is keep physically active with MCO. Okay, ladies and gentlemen, now we come to question and answer session. I will take 3 questions and the panel will answer the question given. So the first question that I have picked is, will climate change make the COVID-19 pandemic worse? Okay, any panel volunteer answer the question?
I will answer the question. Okay, thank you, Aiman. Okay, first question. Will climate change make the COVID-19 pandemic worse? Okay, there is no evidence of a direct connection between climate change and the emergence of transmission of COVID-19 disease. As the disease is now well established in the human population, a effort should focus on reducing transmission and treating patients. Okay, as a result, to reduce the risk of future outbreaks of other new diseases, there are some ways such as strengthening health system. Second, improve surveillance of infectious disease in wildlife. Three, livestock and humans. And the last one is greater protection of biodiversity and natural environment. So that's all my answer. Thank you.
Okay, Q for your answer. Okay, the next question that I have picked is, are there any vaccine or other medical product available to prevent COVID-19? Okay, anyone volunteer to answer the question?
Okay, I will answer the question. For me, the vaccine or medical product available that government provide free vaccine for us can only prevent us from serious risks such as being admitted to the ICU. I hope the vaccine can lower COVID-19 case in the near future if we can follow the SOP. That's all from me.
Okay, thank you, Mashi, for your answer. Okay, and the last question is, how to control COVID-19 from spread to public?
Okay, I will try to answer that question. So, to reduce the new case is actually starting from us. We have to follow all the SOPs, follow all the guidelines that given from our government, and do all the necessary things that can keep us away from the virus, so that the spreading of the coronavirus will be decreased. So, in a simple word, I will say that every of us should have I should need a discipline in ourselves to not doing unnecessary things that can affect our families, that can affect everyone. So that's all for me. Thank you.
Okay, thank you, Arifa, for your answer. Okay, ladies and gentlemen, finally, we come to the end part of our webinar presentation. We would like to say thank again to our panel for the informative and interesting talk, and to audience for active participation. Hopefully, the presentation will be beneficial for everybody. So, thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.
Salam.
Okay, thank you so much for sharing your ideas and also for answering the question. Okay, I think that you had done a very good job by explaining to your classmate about the virus. Okay, and I hope that everyone take notes. And today cases has been increased to 8,290, so we need to be extra careful. And I hope that all of you will stay at home, take care of yourself. All right. Okay. Thank you so much.